name is Tara Talbot, student number T007-45663. And this is my patient, Vinny. He's a Shih Tzu dog. And my clinic mentor, Dr. Zoe Noble. So we're gonna be doing an Emavert injection here. So this is the dose. The expiry is in 2026, so we're good here. Using a 3 ml syringe as we're drawing up 1 ml for his body weight, which is 9.9 kilos. And then we have a 22 gauge needle to draw up, but I'll also be using that for the injection as it can sting sometimes. So, gold standard is cleaning the top of this, making sure that it's clean on the outside. There we go. Now I'll be drawing some up, so 1 ml. Hopefully we have a ml in here. We might not. Oh,
You do have more where it came from.
yes. It's like the tiniest bit off.
That looks like a male.
That's good for a ml for you, Dr. Noble.
Yeah.
So here's my ml with no bubbles in the syringe.
Beautiful.
Okay, changing the needle, throwing this one in the sharps. Again, ensuring there's no bubbles. We want to check again. Thank you. Sorry. Okay, so we'll be doing this in a sub-Q. So just in skin here.
Try it the other way, or you good?
Yeah, I might come around onto this side, actually. That would be easier. Sorry, Jules. So, we create a nice skin tent here, and we'll be going into the skin there. We have the bevel up, and poking through, drawing back, no blood, no air, going quickly because it can sting. Good boy. Okay. Capping the needle. There we go. No blood, and he didn't react, which was nice. There, perfect. And then for cleanup, I just throw all of this stuff into the garbage here. Sharps into the sharps bin. And then once our patient is gone, I would be cleaning the entire surface with Prevail, spraying it and wiping it down and making sure all the debris is gone. And that's how you do a sub-Q injection on a dog. Hi, my name is Tara Talbot, student number T007-45663. I have my patient Clyde here. We're doing an IM injection to prep him for surgery. And I have my clinic mentor here, Gwen. She's a vet tech. So we're gonna be doing saline just for practice first. So I have my 3 ml syringe here. And I'll be using a 22 gauge to draw up the saline, but I'll be using a 25 gauge needle to do the injection just because he's a little guy. He is on GABA and Traz, so he's nice and calm, but you just wanna make them as comfortable as possible. So gold standard, alcoholing the bag, just because we don't know if it's clean on the outside or not. Drawing this up. And as you can see on the bag, the expiry, or that's the date we opened it, sorry, is October 7th. So our standard is that it's good for 2 weeks. And so recapping, discarding in the sharps container, and then getting my 25 gauge. Oh, sorry. And then putting our label on here. So it is just saline, and we're using it right away, but you would also write, if you were leaving this, the patient's name and the date that it was drawn up. You can see that there's no bubbles in the syringe. So it's ready for injection. So she's gonna be having an arm under his head, and then an arm slightly underneath behind his front legs. And I'll be isolating the muscle here, so in front of the hip and to the left of the spine. So have a nice epaxial muscle there, isolated. So in front of the hip, left of the spine, up, nice. We have our bevel up there and going straight in, dorsal to ventral, boop, drawing back. There's no air and no blood, and injecting.
Good boy.
Nice and slow. Perfect. Pull straight up, rub it, that way it doesn't bother him. And just check, make sure there's no blood or anything. We are keeping him on the table for surgery, but if we were done with him, I would remove the towel, put it into laundry, and I would be disinfecting the table with Prevail and wiping it down. And my sharps, they go over here, and then my garbage here. And that's how you do an epaxial intramuscular injection on a dog. Thank you. Hi, my name is Tara Talbot, student number T007-45663. My clinic mentor, Gwen, and RBT. And this is my dog, Keswick, or Keswick. It's spelled strange, but it's a cool name. I'm gonna be doing an IM injection into the semimembranous, semitendinous. So I'll be feeling along the femur here, and then pushing caudally to isolate the muscle. So, he is on GABA and Traz, so he's a bit nervous. For the purpose of this video, I'm just going to be doing 1/2 ml of saline, if I can open the syringe package. Just because I don't do controlled drugs yet, that's okay. So, gold standard for the video, and we should be doing this in general, is to alcohol the container that we're drawing the fluid out of. So we actually have our saline here, an ACL, and the expiry, that's when we opened, October 7th. It's good for 2 weeks, so it's good until the 21st. So I'm alcoholing the opening there. That way it's disinfected. We don't know what's gotten on there since then. So drawing this up. I'm using a 22 to draw up the saline, but I'll be using a 23 gauge needle to poke him, just because he's a little guy. Make sure there's no bubbles. So, just guarding my extra needle in there, and then putting on the 23 gauge needle for Keswick, and then labeling my syringe. So this is just saline. And if I were leaving this unattended, I would also write the name of the patient that it's for, as well as the date that I drew it up. So there are no bubbles. Oh, there is a bubble. I'm a liar. Let me get rid of the bubble. Okay, now there's no bubbles. Great. It would not go out, so no bubbles. We don't want to inject that into their muscle. It's not nice. So, okay, so now he's nice and comfy with Gwen, holding him underneath the towel like that. So here's his femur. And then pushing caudally to isolate the semitend muscle. Nice thick muscle there. And this is a little bit backwards, but so going from cranial to caudal, that way we don't hit the sciatic nerve. And boop, into the muscle. Drawing back, there's no blood or air, and pushing in. Perfect, and pulling back out, straight back out. And just checking to make sure he's not bleeding or anything like that. He seems good, he's pretty calm, so he's good to go there. And that's how you do an intramuscular injection in the semimembranous, semitendinous muscle on a dog. Thank you.